好，各位观众，大家好，欢迎收看港湾 TV。今天是12月21号，星期一，为大家现场直播BC 省的新冠疫情的最新通报。今天呢是这个礼拜是圣诞节的这一周，可能今天的安排，这一周的安排会和往年不一样，因为礼拜四是 Christmas Eve。他说明天是书面。
With COVID-19 case numbers and other relevant
书面的
information
简
with
报
respect
通
to
知
the pandemic in BC. On Wednesday, December 23rd, we'll be giving an in-person briefing here.
明天还是礼拜三还是回来
at 3 o'clock.
大约3点钟左右。
Include some modeling data, some data
包括一
about
些
the
模
course
型
of the
分析以
pandemic
及数
in
据的分
British
析。
Columbia that will be provided by Dr. Henry. And with that, it's my honor to introduce Dr. Bonnie Henry.
好，介绍首席医官上台。给大家公布，
Thank
今
you
天
very
是
much
周
and
一
good
，3天
afternoon.
的周
And I
期
do
的。
just want to acknowledge that we are speaking to you today from the traditional and
又来
unceded
了，本来
territories of
是
the
卫生厅长说
Lekwungen
的，现在
speaking
他说了啊，
people,
感谢原住
the
民。
Songhees and Esquimalt First Nations, and we're very grateful to be talking to you from these lands today. As you know, today we're reporting for 3 reporting periods, and from Friday to Saturday we had 652 new cases diagnosed with COVID-19 in the province. Saturday to Sunday, there were an additional 486 people diagnosed with COVID-19, and Sunday to today, 529 new cases identified. That gives us a total of 1,667 people diagnosed with COVID-19 over the past 3 days, 14 of whom were epidemiologically linked cases. That brings our total in British Columbia to 47,067 people who've been diagnosed with COVID-19. Of the new cases, 283 people were in Vancouver Coastal Health Region, 1,084 people were in the Fraser Health Region, 21 were in Vancouver Island, 189 people were in Interior Health, and 90 people were in the Northern Health Region. We now have 9,718 active cases in all areas of the province, 341 of whom are in hospital, 80 of those in critical care or ICU. We do have probably slightly over 9,651 people who are under public health active public health monitoring. There's been a data
他说有点因为数据收集的转换，可能因为对内陆
under active monitoring in Northern Health
所以数据有点出入。
updating that tomorrow.
会明天给大家更新。
And in addition, we have 35,455 people who've recovered from COVID-19.
35,000多个已经痊愈了。
As we know, we've had a number of outbreaks in long-term care, and that reflects in the fact that we had 41 people in the past weekend who died from COVID-19, bringing the total number of people who've died to 713 in British Columbia. And of the new people who have died, most of those cases, again, were people in long-term care. This weekend, families, care providers, and communities have lost loved ones. We know that this is such a challenging time.
他说这个对死亡的家庭来讲真的是太困难了。
We have 5 new healthcare outbreaks that
现在有5个长期护理院或者是急诊性诊疗所的爆发。那么伯尼医生的死亡总数已经错了啊！有记者一定会问的，总数上个礼拜4是713，他说今天还是713，这是他错了。
Seniors Village, Royal City Manor, Harrison Point, and Aged Care Harmony Court Estates. So we have 55 active outbreaks in long-term care assisted living and 6 in acute care units. And we currently still have 1,424 residents and 792 staff with active cases. In addition, we've had new community outbreaks at 2 coastal gas link locations in the Burns Lake and Nechako local health areas. Northern Health is working with Coastal Gas Link and with Pacific Atlantic Pipeline Corporation to address the issues that are occurring in the areas along this this project, including issuing orders around safety staffing and COVID safety plans that must be reviewed by Public Health and Northern Health before the operations start again. Last week, we immunized 3,644
3个礼拜3000多个接种了疫苗
who received the COVID-19 vaccine in the lower mainland.
他说是主要是低陆平原。
vaccine deliveries have
那么今天呢，给大家更新一下，那么所有的卫生局都有了疫苗了。
Last week in Vancouver and in Fraser Health, teams in the other health regions are preparing.
所以他说，过去的周末里边呢，这个各个卫生局都在积极的迎接疫苗，感谢他们的辛苦努力。那么，所以呢，事情变化很快啊，我们继续的看到持续向好啊。那么大家看到了疫苗的陆续的到达。那么，所以上个礼拜是一个很了不起的开启，我们省开始接受疫苗。那么接下来的1月、2月，我们都会给大家重大的更新啊，会给大家说有多少人已经收到了接种了疫苗啊，怎么接种啊，所以请大家耐心一点，我们会给大家更多的详细信息。那么我也知道，很多人对这个新冠病毒的变种变异啊，都有一些新的疑虑啊。那么因为英国看到了这个，他说我们时刻关注着，所以我们已经一直在关注这个变化的发展。所以因为病毒的变异一直在变化，一直在做。那么主要是大家有这个，那么美国过来的那些病毒啊，我们都一直在看，我们也监测国际过来的病毒啊。他说英国现在的这个变异的情况是一种新的形式啊。那么其实一共有17种变化了，都有了。英国只是现在一个之一啊。那么问题呢，那么他说目前为止这个病毒虽然变异了，没有变坏的那种太快，但是呢，传播的速度会越来越快，越容易传播。他说，主要呢是因为这个可能性存在的，主要是这个病毒里边有一个蛋白在变换，那么这个让接获者呢很容易的去获得这个病毒。所以这个是要希望大家知道的，我们也是希望大家认真对待这个病毒啊。那么也是逐步我们要密切关注这个病毒的其他变化。
We've had a number of meetings over this weekend.
那么我们其实在过去的3天周末里边，我们也开了无数的会啊，特别是关注加拿大以及 BC 省啊。他说我们整个加拿大的我的这些同事们都关注这个病毒的变化。那么昨天呢，联邦政府也是颁布了临时的禁止到英国的旅行禁令，以及他们的出来的断航，其实就是断航。那么希望呢，这样的话能够确保尽量的不要让英国的新病毒带到加拿大来。这个希望大家还是重视，现在要采取适当的必要的措施。所以同时我也要求我们属下的所有的卫生室、实验室都要密切观察、关注这些新病毒的变化和变异。那么目前为止，我们还没有 BC 省没有啊 ，BC 省没有新的英国的那种病毒株发现啊。我们已经看到了，他说那么一共17种变异里边，我们是看到一些在我们 BC 省的，但是这次 英国的这个变异的病株，我们在 BC 省目前没有发现。那么所以这个是很重要的一个，大家要知道一点。那么病毒的变异啊，不等于就是这个越来不等于使得我们的疫苗失效两回事啊，疫苗还是有用的。这个我相信大家也是在微信里边也学到了很多的这个疫苗的知识啊。这一个是灭活，一个是 mRNA， 那个辉瑞和莫德纳都是 mRNA 的技术。
Slowly, it can take days or weeks to understand.
那么希望大家也是把这个自己的行动慢下来啊，这个也是要花时间来消化。那么现在呢，每一步啊都是会对2礼拜以后的，包括现在的这个急性症诊疗所啊，对我们的急诊啊，对我们的住院啊，都会慢慢的持续的影响。 那么现在的变化都是两个星期之前的行为所造成的结果。所以现在他看到我们 BC 省每天还有新增几百个、500-600个，那么看到了 BC 省现在这个病毒还在传播那么现在这个病毒的传播的范围还是很大的。在我们人口还是很有一定的比例我们看到了每天还有几百个人的新增案例而且使得他们这个新增的还会传播给其他的人那么特别是那些紧密的接触的这个所以这个数字还是很大的，都是通过亲密接触传染的。
We have to remember that people getting sick today were in contact with others days ago.
所以今天大家如果有人得病的话，那么其实要追溯到2星期之前他所接触过的人。所以这个使得我们每一个人都要清楚我们现在所说的行为都是要2星期、下星期以后的产生的后果。所以我们希望大家，特别是这个礼拜要度假了，渡节了，所以希望大家那个人员少一点，他 stay small 这个中文比较拗口，就是希望大家接触少一点。这个就是我们也是如何进入新年，也是这么度过，也要这样要坚持。那么他说我也很多同事这个公卫系统工作人员朋友同事我已经说了很多次了
And they are in need of a reprieve.
所以他们也是希望我们每一个人都能够做好自己的这样的话希望大家每个人做好自己的分内的事情，这样的话呢能够保护自己，也保护家人，保护我们的医疗资源，也是保护我们的公卫系统工作人员。我也要求我们的公卫系统团队进一步的这个持续不断的努力。我们知道那个疫苗已经来了，但是还是需要有时间来部署，来每个人获得。那么现在2020年马上要过去了那么希望大家有一个明年更加健康、更加安全的2021年。希望大家目前为止社交面不要太广希望大家还是安全，请求大家马上做任何安全的事情现在就开始。那么同时呢也要关怀那些被人遗弃忘记的人，也要关心他们。那么让我们共同安全的度过这个安全的周末这个节假日让同时开启一个安全的2021年。希望大家持续的坚持继续的安全大家相互之间容忍同时呢安心。谢谢大家。
Thank you very much, Dr. Henry, and I wanted to start by expressing and sending my condolences. Those of the Premier, those of the government, those of people in BC, to the families, the friends, the caregivers, the communities, and the 41 people who passed away this weekend over the past 3 days due to COVID-19 or related to COVID-19. 17 those people are in Fraser Health, 14 in Vancouver Coastal Health, 9 in Interior Health, and 1 on Vancouver Island. And just to note that the 9 in Interior Health is significant and shows the potential impact, particularly in long-term care, of transmission of COVID-19. We, I think, before this weekend, only had 8 people pass away in the entire pandemic in Interior Health. I also wanted to, for all of those people in Interior Health, on Vancouver Island, people in Metro Vancouver, all of the people who passed away from COVID-19 this weekend, our hearts go out to you. This is a very, very difficult time. This time of the year makes it more difficult for many people. Our inability to
也就是你们的痛苦我们都知道啊，就这个意思。41个死亡，真的是太厉害了。是我这个没算错啊，14个、19个14个、17个，就是沿岸是14个，那个飞沙是17个，那就31个了。内陆是9个啊，还有一个是北部，那一共是41个死亡。这个太厉害了。
5 people per day, and significantly more than this time last year. I want to say that we continue to work on.
所以这也解释了为什么这个重症监护从98个一直到80个。我相信这里边有一部分是死掉了啊，这个很不幸啊，这个真的是每一次生命的死亡，真的是给人类带来的不幸。
As many of you will know, our healthcare system continues to operate at full strength, but also at maximum capacity. Yesterday, for example, 4,641 emergency room visits.
那么现在的这个急诊室也是全负荷运转。昨天他说就是4000多个病人去访问。
9,718 active cases of COVID-19.
那么现在我们记录在案的是有9718例啊，这个记录在案的活跃的案子也要9718个，所以这个公卫系统的工作人员的工作量是的确是挺大。
The usual level of occupancy at this time of year. The overall beds are about 66.6%.
那么现在的病床普通病床占床率是2%左右，66%、67%。
72% of our base critical care beds, and just under 50%, 49.8% of our critical care beds when you include the surge beds that we have added. It's 341 people in hospital from COVID-19
341个这个新冠病人住院啊，那么其中80个在重症监护，那么这个重症监护一半已经给了，还有其他的开刀的这个急诊用的，还有一半就是现在被占用了。
Since the month of March, where we are in the pandemic in BC and why it's so important right now for all of us.
所以他也是说到了，从3月份以来，我们一直关注的医疗资源的占用情况，这个是我们一直关注的这个情况。那么他说也是现在是给大家公布一下过去一个礼拜更新一下过去一个礼拜我们省获得的医疗防护用品的储备情况。那么很多网友可能不是一开始打开收看我们的直播，3天的数字是652个。 是周5到周6，周6到周日是486。我第一次听到有400多个。我看看啊，从什么时候开始的？12月份、11月份、11月19号还有11月份的话。 11月份都是600多，哇，400多是从10月份。11月还有300多了，然后11月中旬以后到现在都是500、600，这次第一次看到486啊。然后呢，昨天到今天是529个，3天呢加起来是1667个，总数到了47067个。
In total, in the entire influenza
那么住院呢是341个，其中80个是在重症监护。
256 doses to date this year, and we're just partway through the campaign. Pharmacists have administered 1,001,204 doses. So last year it was about half of all doses administered. This year, it's approximately 70%. Finally, many of you may have some questions about the NHL, which is a little bit in the news. Just to say that, as you know, the NHL has made a proposal with respect to I guess it would be the 2021 season of the league. We received that proposal just in the last few days, and obviously we'll be looking at it. As you'll be aware, the NHL, in a time when COVID-19 was less prevalent in our country and in our continent, engaged and had a bubble for its players that turned out to be, for them, quite successful. They are proposing a different system on this occasion, and our public health officers across the country are reviewing that. Like I say, we've received it and we're briefed on it on the weekend, and
对不起啊，因为他都是说的一些这个数字啊，我所以就没给大家去啰嗦了。
From our own experience that COVID-19 is ruthless in its mission to spread. We know from experience that our fight to loosen its grip must be, relentless. So our primary job is to stop the spread.
所以他也是说到了停止阻断这个传播是我们的重点之重啊，这个首要任务。
When in doubt, rule it out. I ask everybody in this
所以也要求每一个人啊都要遵守我们的首席医官的卫生命令。上次伯尼医生也说过了，现在看来只要遵守行为规范我在想这个呢相当于什么呢？交通规则如果所有的人都遵守交通规则了，那路上也就没有事故了。这个都是这样的，所以伯尼说，目前来看，只要遵守所有的行为规范的话，那么不会有那么多的病毒传播问题就在这儿，这个里边就是仁者见仁，智者见智了啊。那么他也是说到了，因为疫苗已经来了，所以这个是给大家看到的希望了。那么至少我们慢慢的越来越好所以但是现在来讲，每天的新增病例还那么多，还是太多所以请求大家能尽力所能及的做好自己分内的事情保护你所爱的人，也保护你自己。他又说到法语了。
4 heures chacune, soit celle des 18 et 19 décembre, celle des 19 décembre et 20 décembre et celle du 20 jusqu'au 21 décembre en mi-journée. Il y a eu 41 nouveaux décès liés au Covid-19 durant ces 3 périodes de référence. Nous offrons nos condoléances aux familles et aux amis des 765 personnes décédées du Covid-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Pendant la première période de référence, nous avons eu 652 nouveaux cas. Pour la deuxième période de référence, nous avons eu 486 nouveaux cas. Au cours des dernières 24 heures, 529 nouveaux cas se sont ajoutés. Parmi l'ensemble des cas confirmés de COVID-19, 341 personnes sont actuellement hospitalisées, dont 80 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to 1 question and 1 follow-up only. I would also ask that you please unmute your phones. You will not be audible until your name is called.
我看看死亡41个是不是？
还有49个。
12月14号是死亡49个，因为都是为3天。
Dr. Henry, you mentioned earlier that you've just received the Vancouver Canucks and the NHL proposal.
他也是说到了这个是冰球季节的他们的请求那么他说如何去调节政府和这个冰球联盟的这个要求。
The NHL and the Canucks in particular have a proven record of doing the right things and have been very strong in terms of the protocols. So we are looking at this in detail and I'm talking with my colleagues across the country and we'll be responding with our advice in the coming days.
也是听取了他们的意见那么这个也是卫生厅长
Right, all of the medical health officers are obviously
所以所有的各个省的这个卫生医官首席医官都在考虑的这个问题
they'll be looking at these proposals.
大家都在考虑各项选项
obviously significantly different from what was presented in the summer.
那么因为现在他们所要求的提供的所有的卫生措施和夏天已经完全不一样了因为情势不一样了
they're taking a different step, shall we say?
所以大家所有采取的措施都不一样
and that's something to be reviewed, but
我们所以也在不断的检视
it's important that
我们在紧急的检视他们的所有的提议
medical health officers across the country take a look at that and then
所以他说不是我们省单独的行为还有其他省共同联合包括阿省魁省安省
there are many other people and many other leagues that play hockey.
那么包括还有很多不单单是北美冰球联盟，还有其他的冰球联盟也都有存在这个问题。
So there's not
大家不要眼光只盯着 NHL 那还有其他的什么青少年联盟等等。
One standard for another. This is a very serious time in the COVID-19
所以这个是现在是很严肃的时候。
Everyone is coming together. Everybody
所以
is
我也
making
希望大家
extraordinary sacrifices. And we see
要
that
付
every
出
day.
额外的牺
And we
牲。
appreciate, I think,
我也
the
感谢
incredible
每一个
support
人。
that we've received from the Vancouver Canucks over time, their commitment to this effort as well. But, there's also lots of things before Dr. Henry, the other provincial health officer, so we will take a little bit of time to respond.
Farhan, do you have a follow-up?
No, that's it. Thank you.
Thank you. Next question is from David Molko, CTV.
Hi, Dr. Henry. David Molko, CTV here. I just want to draw you out on that new UK variant. I understand the limitations of what we know right now. Can you give us a sense of how concerned you are, specifically what mutations like this broadly mean for whether the vaccines we have right now
那么这位记者还是请他详细解释一下来自英国的变异的病毒你到底关注到什么程度我们的疫苗对它有什么作用效益如何他说我们的这个他也是解释了一下我不一定完全翻译都出来因为完全听得懂也就是说了就是说DNA 里边的变异里边有一个病毒里边有一个变异那么他说我们的疫苗的这个防护呢是共同的就是对这个病毒不管你怎么样变异对它的共性是有防止的所以他说我们现在新的疫苗也是对不管这些病毒如何变异所以在这个也是意识到了你这个怎么那么我们是也是跟踪病毒的变异哪里来哪里变化怎么发展
probably this one mutation with a number of mutations on this one variant arose at the same time and it may be that because it transmitted more rapidly that's why it sort of took over this is what we see happen sometimes that one of the mutations may just randomly confer an advantage to that virus which means that it will take over and spread more rapidly or it will be the one that will infect more people
那么传播的快呢传播的会更多的人去传播所以我们希望大家还是时刻小心那么所有的疫苗包括候选疫苗都是能够对这个病毒是有效的他们会快速的论准这个病毒那么他说我的有些同事比我了解更多有关疫苗的情况
with the mutations that we're seeing so far. But it is obviously something we want to watch very carefully.
他说我们对病毒的这个防疫对病毒的这个有效还不是太关注因为这个科学家们这个都研究出来这个问题那么我们主要关注的是这个病毒的变化速度以及传播的影响这个是我们这个那么我们也希望这个疫苗的有效性时间长一点有效期更长一点
for about 11 months now.
那么现在大家知道是至少是11个月因为现在这个病毒才11个月目前现在只知道就有效期可能是11个那么这个是最长的因为没人知道有效期是多久嘛有持续多久
Well, right now it doesn't change anything for us.
所以他说我们现在这个英国
that it seems to be spreading more quickly. So if there's a virus that's spreading more easily, that gets introduced here in BC at this point, that would concern me because that means that we would, the whole start of our immunization program and recognizing that the amount of vaccine that we have is not enough to protect everybody right away. It just makes me want to make sure we're protecting people as quickly as we possibly can.
我现在主关心的是能够有多少人得到有效的保护这个是我们开启疫苗的计划的一个最重要的原因那么我同时关心的就是有多少人住院占用多少医疗资源所以这个都是我们行为的规范的这个病毒所以这个病毒全是我们的行为所导致的后果
It just means our little bit of leeway that we might have had had, and we saw that in the summer, it changes during this time of the year. If we have a new variant that makes it transmit more easily, we have to be even that much more careful and more fastidious to protect each other and to stop those chains of transmission.
Next question is from Moira Whitten.
他们更加关注的问题所在因为疫苗呢基本上还是对病毒变异还是有效的这个就说到了灭活疫苗和莫丹纳和辉瑞的另外的 mRNA 的病毒疫苗的这个区别。
And the seniors advocate to do this as soon as possible with the holiday season, what will be many seniors' last holiday season in long-term care approaching, and what your timeline is on this change.
So I think what we said was that we want to make sure that those requirements around essential visits are implemented in a way that's consistent around the province, because what we were hearing was people were not being allowed to be designated as an essential visitor, and many of them absolutely were. So that was our focus over the last little while. As you know, as the increased levels of transmission in the community have made it even riskier in long-term care. What we're trying to do is make sure that we maintain those safe visits that have been in place over the last few months. And really, the focus on being able to safely visit in long-term care is why we are immunizing both healthcare workers and people as soon as we can, residents in long-term care, because that is really going to make the difference in protecting them and making sure we can have those real visits with our family in a safe way as soon as we possibly can.
所以这个可能不方便，也没有这个节日气氛。但是没有办法了啊，这个也是。
On the vaccination strategy, I know that it's still rolling out just within healthcare workers. But when you think about creating a successful vaccine strategy for the general population, there are a number of people who are quite skeptical, and including communities like Black and Indigenous people living in British Columbia who have reason to distrust public health advice. How is the province approaching those community-specific concerns as you start crafting that broader strategy?
Yeah, those are things that we're concerned about. We know that there are challenges with what we call vaccine hesitancy, and people very rightly have questions. This is a new vaccine, particularly the one that is licensed for use or has a notice of compliance, as we call it in Canada, and hopefully the Moderna vaccine will also get that soon. These are new technologies, new platforms. People very rightly have a lot of questions, and we've been seeing that in the clinics. I was at one of the clinics last week and talking to people about this. And what do you need to know? What do you need to understand to know that it's safe? I think part of the important messages that are coming out from the public health community and from Health Canada about the processes for assuring that the vaccines work and that they're safe and that we have not lowered or changed any standards. It's still a very high standard so that we are confident that vaccines are safe and that they work and what populations they work in. So we have started talking about that. We have our strategies, and healthcare workers, like everybody else, have questions about the vaccine and the new vaccines. So we are putting together the materials to answer those, and also to have it in the languages that people need to get the information in. So we are working. I've had many conversations as recently as last week with the First Nations Leadership Council. It's privileged to have some time to speak with them about the vaccine. So yes, I think these are very important considerations. We know that this virus the pandemic has differentially affected certain populations, and those are people who need to have equal or equitable access to vaccine so that they can protect themselves and their families as soon as possible. So we absolutely recognize that and are putting out as much information as we can about how the vaccines work, about how they were evaluated, how we ensure their safety, how we monitor very carefully for every vaccine given to make sure that we pick up any signals that arise. And we saw in the UK and in the US there were some allergic reactions to the vaccine, so we've adapted our materials to help people understand what that means for you, and we'll continue to do that. There are many, many moving parts right now, including the amounts of vaccine that we're getting at different times is still up in the air. So as we move through the next few weeks, hopefully that will become more certain, and then we'll be able to tell people with a bit more certainty, what time frame are we looking at for when you might be in line for vaccine. So that's something that we will be giving you as much information as we can in the coming weeks.
Arthur Williams, Prince George citizen.
Yes, Dr. Henry. I was hoping to find out a little bit more about the vaccination strategy outside the lower mainland, particularly the north and the interior where the certainly we've seen surge in cases over the last while.
Absolutely. So our strategy is similar in that the target areas are to protect those most at risk as a start, and that we have in common across the country and across BC. Our challenge that we have right now is we were, last week we were only allowed 2 areas to send vaccine to, and they both had to have an ultra-low temperature freezers. So we focused on the lower mainland because, as we know, that's where rates and numbers of transmission of disease were highest, but also where they were ready to start and they had the appropriate things in place. So far, Pfizer still requires us to only deliver vaccine at the point of arrival of the shippers with the ultra-low temperature freezers in sight. So that restricts things a little bit. We were hopeful that once the supply chain had been approved across the country, that we would be able to break down the trays of 975 doses and be able to take them out to different areas. We have not yet had that release from Pfizer, so we are still limited. We're hoping it's going to come in the next few days, and then the strategy will be to be able to take vaccine to long-term care homes and to immunize residents and staff at the homes. So right now, this week, at least today and tomorrow, the immunization clinics that will be starting tomorrow in the north and in the interior will be focused at people coming to receive vaccine. But as soon as we can, we'll be moving out into the community. As well, we're hopeful that the Moderna vaccine doesn't have as strict requirements for ultra-low temperature freezing, and it can be broken down into much smaller numbers of doses. And when we've developed a strategy, an initial part of that strategy for when we receive Moderna vaccine, when it becomes licensed by Health Canada, that we can bring that out to a number of remote and isolated communities and into care homes themselves. So that'll be the first phase of how we're moving through this.
Arthur, do you have a follow-up?
Yes, in terms of, I think it was last week you mentioned there would be 9 sites starting this week outside of the lower mainland. Any indication of what those sites are, and in particular, I'm hoping to find out, given just the size of both the north and the interior, if there is, only one site in the north, presumably Prince George. For someone in important health and healthcare worker or whoever, that's a long way. Any, mention of sort of how that's going to work, how those folks in those much outlying communities may be able to get access to the vaccine?
Yeah, so this week there is 9 sites that vaccine has been delivered to. Some of them are still in the lower mainland. There's a couple of sites on Vancouver Island and interior in the north. There is 1 site, as you say, and it's still a very limited amount of vaccine. We don't have a lot of vaccine yet. We're only getting about 30 trays between now and the first week of January. So it is a small amount to make sure that the delivery system
300多针，所以就3盘。他说第一个礼拜是完成了3900多个人的接种嘛，这个是30盘一盘一盘的。这个大家都听到了很多这些学习了这些新的信息啊。
subsequent doses and how they will be broken down, but a lot of it depends on us being able to
我也理解了，就是这个一盘190几个，就是要给一个地区就一盘一盘给的，不能说啊我给你50个，把这个一盘里边50个拿出来，不可能不一样啊。运输的时候卫生要求不一样，要零下70度，所以这个可能就是具体的技术情况。他说，所以呢，现在如果我们开始接收莫丹娜的疫苗的话，我们会考虑其他的一些策略。现在好像还没批，加拿大还没批莫丹娜的疫苗，不知道批了没有？应该很快了，美国都要批了，所以这个加拿大会马上跟进的。说到疫苗的批准的话，英国反而第一个，所以川普也提了啊，说英国都批了辉瑞了，你们美国的 CDC 在干什么？后来过了2天 ，CDC 也就批了啊，这个政策完全不一样啊。那个川普没有权利去领导 CDC 的，所以川普只能发牢骚。不过这个也是美国可能更加严谨一点，英国。
Next question is from Ian Bailey, Globe Mail.
英国是先批了全世界第一个批的辉瑞疫苗。
About the book that you and your sister have written. It says that you are going to donate your advances to charity, but I'm just curious, what about other revenues from this project? And if you're not going to do that, is that fair for a public servant to profit from work they do on the side of their work as public servants?
Yeah, well, I can say that this book was something that I wrote on about my 6 days off, and it really is about the personal story of what we went through. My sister and myself during a period of time in March, where we were all going through many challenging times. And yes, I used the opportunity to make a donation to First Book Canada, and it's an organization that provides support for children around Canada to make sure they have access to literary supplies, books, and education. And that is something that is near and dear to me, and something I feel is very important, particularly as we know that young people have suffered from the challenges through this pandemic in the last few months.
Ian, do you have a follow-up?
Yeah, to make a sort of a split follow-up on that first question. Will you donate all ongoing revenues beyond your advance to charity? And this may be also a question for Minister Dix. How in this book do you sort of deal with breaching or reporting on, shall we say, the confidences of conversations you may have had with the Premier, with Mr. Dix, with other members of Cabinet? Are you going to report on those conversations? And if you're not, what value will you
那么也提到了，就是省长啊、卫生厅长啊和他之间有没有这个政治压力啊？还有，因为所有的这个政策的决定啊，有没有来自政府内阁的压力啊？那么所以他只让这个卫生厅长来解释一下。
Dr. Henry, when I became Minister of Health, gave me I visited her in the Ministry of Health Office. She was not the provincial health officer at that time, but
他说我做卫生厅长的时候，伯尼还没有做首席医官。
I recommend to everybody because of I think it's a real contribution to public understanding of the very issues that we weren't dealing with in the same way then, although do in part, and we are now. And so she's an extraordinary person. I think her insights are going to be of great value. All of us.
他说：“这个所有的命运决策呢，是伯尼医生利用他个人的专业知识做出了很大的贡献。也就是说，听了他的意见命令都是极大的听了他的意见命令建议。”
Absolute confidence in that what she's going to present, one, will be vastly readable. And I look forward to, I'll be first in line at my local independent bookstore to pick it up, vastly readable. And secondly, will, as she always does, be consistent with her, I think, extraordinary commitment to public service. I must say
他
that
也是说到
I
了
happen
这
to
本
know
书体现
that
了我们的伯尼
I've
医生
taken
一贯
probably
的
about
对这
7
个
days
公
we
共
haven't
事
dealt
业、
with the
对公共
pandemic
安全的
in
这个
BC since
专
the
业
beginning
的
of the
精神
pandemic, and that
以
Dr.
及
Henry
这
has
个努
taken
力。
less. The fact that she's able to write anything in her off hours is a matter of extraordinary, I think, achievement. But in any event, I'm looking forward to the book. I think it's an excellent contribution. I know there's going to be no issues of the kind that you've raised, Ian, and I'm looking forward to reading it and getting her insights, because there is, as in every story, there is the public policy journey. There is, of course, an epidemiological journey that we've all been living in their personal stories, and I'm looking forward to hearing what Dr. Henry writes. But it won't be for a few months. So, in any event, there are, as far as I'm concerned, no issues.
Next question is from Cindy Harnett, Times columnist.
Hi, thanks so much for taking my question. If I can just return to the delivery of the vaccines, can I confirm that 2 sites on Vancouver Island that we've had delivered to? And what is the time frame for that you would kind of foresee, or that you're planning on or hoping for all healthcare workers in long-term care and
那么时间表了，既然有2个点，那么岛上的这些长期护理院公卫系统的工作人员护理人员，他们的施打情况怎么样啊？你给一个时间表。
I'm pretty sure there's two sites on Vancouver Island.
他说我记得是2个岛上有2个点是收到疫苗。
Yes, the focus is on starting with long-term care because we know we don't have enough vaccine to break the chains of transmission in our community yet, but we do have enough vaccine to protect people. The shipments that we're receiving over the next couple of weeks, sometime by end of January, we should be at a point where we have been able to provide protection to residents and workers and essential visitors of long-term care and the key frontline healthcare workers, people involved in the COVID response that need to be immunized, and then we'll be moving on from there to other priority populations. But there's a big but there, because we do not yet have guaranteed numbers of vaccines coming in per week. We just found out how many doses we're getting for the week of the 4th of January. So there's lots of things that are still in flux, but the intent is to try and as quickly as possible provide protection to residents of long-term care and then assisted living and independent living and elders in our community.
Follow-up, Cindy?
Yes, please. So I may be interpreting that optimistically as maybe something like March for all of the long-term care residents.
那么他说，我乐观的估计的话，是不是到了3月中旬的时候，所有的长期护理院的疫苗免疫系统都建立起来了？
in Victoria, where the minister is saying, people are allowed in malls, churches are delivering something that is more needed in the community, and they're going ahead with services. Is there anything more that you would like to say on that topic?
So in terms of the vaccine, I hope that we will have long-term care residents and staff protected well before March. But again, as you say, it depends on how much vaccine we get when. In terms of the church services, I think most of us understand that there's something fundamentally different than being together in a building for a religious service than a transactional service or something that's transactional in a mall, buying something in a store where they're in there for a very short period of time, we're wearing protection. It's not the same type of environment where we see transmission. And the virus doesn't recognize that
病毒的，它不会认为你是这个是教会，你这个是家庭它传播会不一样，它不一样的，它病毒不管的，所以这个很悲哀的看到，我们看到了很多老年人都穿得很好的，都附带了很好的去教会，还是得到了病毒，获得了病毒，所以他说这个全世界看上去都一样的，所以这个我们的 要求还是要求保护人。我们也知道大家需要在这个宗教信仰方面有更多的活动参与，但是我们现在目前是希望保护每一个人的安全，所以呢，也请大家原谅理解。
With the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Zara Premji, CBC.
Hi, Dr. Henry. So what is your direct message to people who are heading to Whistler over the winter break or at all right now while we have many public health orders in place until January 8th? Ontario is closing all ski hills as part of their increased restrictions that start on December 26th.
他说请你给我们那些还要计划出去度假的那个直接的建议，因为很多地方都关了，安省的滑雪胜地也关了，我们的禁令是到1月8号，所以你还是要给这些还是计划外出的人给一个建议，直接的建议啊。
But I am asking people to stay local.
所以他说希望大家还是尽量待在本地，local 就本地，就待在本地了，不要再走了不要再因为密集这些大家聚来聚去。
Whistler has been very good
他说 Whistler
the lineups and
他也看到了还有排队还有聚会我们不希望看到这些现象。我们都看到了很多的这种情况病毒的传播都就是因为大家聚集在一起，所以这些地方就是病毒传播的地方。所以希望大家能够停止。
Yes. So first off, going to that same question, though, is it disheartening for you to see that people who are not from the Pemberton-Whistler area are gathering up in Whistler? And then also, can you clarify the number of total deaths in BC? Because the dashboard said 724 on Friday, but you said the total was 713 today.
我就说了吧，所以这个伯尼今天出新了，他说上星期五都说死亡总数是713，你今天又说713，但是新增了41例。他说我要更正一下。对不起，我希望谢谢你调整错误。我们会更正。
And did you want to? About Whistler. You know, we want people to stay local. I know there's a lot of people in Squamish and in Vancouver.
也好大家就待在本地了，你不要你在温哥华，你到那个 Whistler 去不要。
People need to use the basis of the orders. What we are suggesting to people is you stay local.
所以我们建议大家还是待在本地少一点，人少一点，聚集少一点。
Oui, je pense que en français c'est simple.
是刚才这个记者，因为我星期四做直播的时候记下来，累计死亡713，但是他今天又说了是713，这个是错误了。在过去的3天里边新增了死亡41例，真的是太可怕了。那么不是所有的网友一开始就听我们的直播，我再把过去3天的数字告诉给大家。周五到周六新增了642，周六到周日新增了486，周日到周一是新增了529例，3天累计1667例，总数到了47067例了。那么在过去的3天里边沿岸卫生局新增了283例，飞沙卫生局新增了是1084例，岛上卫生局新增了26例，北部卫生局新增了90例，内陆卫生局新增了189例。那这个目前为止记录在案的活跃案子是9718例，其中住院的是341个，重症监护是80个。过去3天很遗憾，一共是死亡了41例。所以，那么谢谢大家。他说我们礼拜3再见。那么各位网友也是，圣诞快到了，也祝大家有一个安全的、快乐的、 不一样的圣诞节。那么也祝各位网友今天是冬至啊，冬至安。那么我们礼拜三再会，谢谢大家。